We've relied on them now more than ever, right? Frontline workers in hospitals working to save lives amid the COVID-19 pandemic. But that work is far from easy, right? The normal routines have changed, and even the way they show empathy looks different. In this series, we speak with several frontline workers pushing through the challenges while providing others comfort. And today, I'll introduce you to Kathy Riegelman. We sit down. She's a chaplain at the University of Kansas Medical Center. True love knows no limit.
It doesn't feel good to have to limit love.
Unless it's at a hospital during COVID-19.
My heart says, compassion rules, and we want to have as many people that love a patient around them at the time of their death, and we're not able to do that now.
In this pandemic, it's one visitor per patient per day, even those in their final days. Kathy Riegelman is the chaplain for the University of Kansas Health System.
As a chaplain, if you had to use a scripture to describe these times, what would that be?
Psalm 27, the Lord is my light and my salvation. And so that's what I want to keep shining through, that this isn't a time where one's faith just drops away, but where that stays intact. But there's another one, that Psalm 69, that says the waters are up to my neck. And there are times when it feels like, we're in this pretty deep.
If the depth of the waters are up to her neck, for Chaplain Riegelman, everything above the neck is covered in PPE, making her job even more difficult.
It's challenging me to find ways to be more expressive with my face when they can only see about a third of it, and to remember to speak up because not everyone can hear my muffled voice through the mask. It wouldn't be unusual for me if it's appropriate to reach out and touch someone on the shoulder or to take their hand when we're praying together. And that kind of physical contact, which is something that can be very important, and another way of expressing empathy, has been limited.
And so Riegelman has had to find new ways to show she's engaged, exaggerating facial expressions, for example, and saying and ah more often.
Because they can't really see it on my face as easily.
The chaplain, who's normally bedside, now provides comfort via conference call.
How much more difficult is that to have your final moments with someone via phone or some sort of video conferencing or something where I can't reach out to you?
It doesn't feel like the most natural or compassionate way to offer care, that's for sure. I've been with several families of COVID patients, and it just seems like it's becoming more and more real how devastating this virus is.
And so the chaplain leans on faith and her husband for comfort.
I know I got home one day after a really hard day, and I didn't say hardly anything, and my husband looked at me and said, I think you need to take a walk. It seems clear that this is turning into a marathon and that it's not a sprint. When it started, I think there was an idea that we were going to get through this probably in months' time, and it's the length of it and kind of the adapting that this is our normal right now, that I know for myself, I'm getting a little bit weary of all of it.
And she's not alone, right? All weary souls need comforting, even if they're tasked with providing comfort to others.
Just hope I can keep doing it and keep going.